Hello, everyone, and welcome back to Season 2, Episode 3 of Transform 360 podcast, where science meets compassion and we explore the intersection of healthcare, innovation, and whole person wellness. I'm your host, Sabar Shah, founder, pharmacist, and a mental health advocate. Today's guest is someone who truly represents the powerful blend of clinical excellence and forward thinking leadership. In this episode, we'll explore Dr. Ali's journey in surgery and innovation, plus wrap up with a fun rapid fire round from his life in the OR to Miaras and beyond. I'm excited to welcome Dr. Jawad Ali, a board certified trauma and minimally invasive surgeon, healthcare innovator, and a clinical leader who's helping redefine care across Central Texas. He is a practicing surgeon, president of Austin MedTech Med, and a general partner at Caravan Health Ventures. With expertise in robotic surgery, bariatrics, and advanced endoscopy, he blends precision, innovation, and compassionate leadership. And today, we are diving into his journey, insights, and bold vision for the future of healthcare. Dr. Ali, we are so grateful to have you today.
Excited to be here. Thanks so much, Sabah. That was a great introduction.
Perfect. Let's start. I know you have done incredible work in medicine, but I would love for our audience to know, what does a minimally invasive surgeon do?
Sure. It's a good question, and it can mean different things. Essentially, surgery is traditionally a large incision. So anything that goes from a large incision to smaller incisions qualifies as minimally invasive surgery. So this can be, laparoscopy, where you put gas into a cavity. In my area, it's the abdomen, but could also be the chest. And then you use a camera and long instruments to do the operation. So instead of a large incision, you do it through these small incisions.
Mhm.
It can also mean robotic surgery, where instead of controlling the instruments with your hands, there's a surgical robot, and then you are at a console controlling the robot. And then more and more, it's also meaning, in my space, endoscopy. So instead of making an incision and getting to the area of interest, that way you do it endoscopically through natural orifice, basically. So I would say those are the main things that qualify as minimally invasive surgery in my field.
Mhm.
And it can also be true for things like neurosurgery, vascular surgery. They all have their own aspects of it.
Thanks for explaining that. I would like to talk about some of the biggest challenges you faced early on and what lessons have stayed with you over the year.
Yeah, in my clinical practice.
Yes.
Yeah, I mean, I would say, even going back as far back as medical school, it's not an easy transition to go even from, like, I did biomedical engineering as an undergrad, to go from that to medical school. And you really kind of have to find your groove, find what works for you to get the education and to excel in this kind of new challenge. And then, residency also, I would say those transition periods, were difficult, but over a year of like just not giving up, believing in myself, kind of learning my lessons, being confident, and really, to me, things that helped were crystallizing what do I want to get out of this experience, right? So for residency, I was like, I need to be a really excellent surgeon. So what do I need? Kind of that, it really helped me prioritize how I spent my time. And if you have a clear guide on what your ultimate goal is, it really helped me go through my day and add those days up, add those experiences up. And at the end of that, you're where you want to be because every day you had that goal in mind.
That's perfect. And you said something, you never stopped believing in yourself. So, what just kept you going? Because nowadays, many people face imposter syndrome and just doubt themselves. So, what was the thing that just kept you going?
Yeah, and I can relate to that. I was just kind of like, either I'm going to do this or I'm not. And this wasn't anything super deep there. I was
Okay.
basically like, I'm not failing at this, kind of like full stop, and then after you have that conviction that you're not going to fail, it's basically what do you need to do to get there, So I think it shifts the conversation from can I do this to how am I going to do this? And so even if you have stumbles or you can have setbacks and failures along the way, but in your mind, like you're going to get there. And so I think that was a helpful framework for me.
Thanks for sharing. And is it important for us to fail and learn rather than succeed at different times?
I mean, I think every initiative you take has an element of failure and success. I think a lot of it is how you frame it. Because let's say, in your clinical work, let's say, for example, even if you have like a bad patient outcome, you work really hard, you tried your best, but sometimes things don't go the right way. In a way, that's a failure. But then in another way, if you take that opportunity and really revisit and dig deep into what went wrong there, maybe then you can take those lessons and become better for the next, hundreds or thousands of patients in the future. And so I think everything has a little bit of that, and at the end of the day, whenever you do something, you have
Mm-hmm.
a risk of things not going exactly the way you predicted. And I think you just can't let that stop you. But then at the same time, you do have to feel that responsibility of, especially in medicine, you have someone's health or maybe even their life in your hands. You have to really take that seriously.
That's true. I hope that resonates with a lot of people. Now, I would like to talk about what like motivated you moving from your clinical work into innovation. I know you're the president of Austin MedTech Connect that brings healthcare and technology leaders together here in Central Texas. What inspired you to create it, and what impact have you seen so far?
Yeah, so I always liked physics. I always liked
Mhm.
economics, and even early on when I was in undergrad, I always had it in mind that I really enjoyed the practice of medicine and the clinical environment, but I always had it in mind that I want to do something that takes my clinical expertise and applies it in a different area, because healthcare, while it's awesome, is for good reason very defined, and you have to operate in very structured frameworks for good reason. But outside of healthcare, you can be a lot more creative, have a lot more autonomy,
Mhm.
explore different things, meet different people. And so I always kind of wanted to do something that was a little bit adjacent to my clinical work. And the easy thing, honestly, is just to start doing advisory work. And so when I was a resident, I actually worked with the UT Biomedical Engineering Group. And it's funny, we just had our event with BME last night. That was Austin MedTech Connect and BME, so it was cool to put it full circle. But I began kind of working with senior engineering students on projects with startup companies. And so that was my exposure to working with the startup world. And I always give a shout out to, actually, this is interesting too. So Dr. Dan Peterson was a neurosurgeon, and he was starting a company called Allofair Biosciences. And as a resident, I would help him do some of the experiments. And, he was exploring a laparoscopic application of their technology. And then actually, now me and him are working together on an investment now too. So we'll talk more of that later. But I always had an interest in working with industry outside of clinical medicine, and that spurred into an advisory practice. And so I began maturing my relationship with different companies. I basically became a consultant. I started a group called Validity Partners, and initially my goal was to basically grow that and take my clinical expertise and help startup companies through an advisory practice. And as I was doing that, a lot of building a consultancy is networking, but it was during COVID. And so I would be like Zoom call after Zoom call after Zoom call.
Yeah.
And then I realized that so many of these amazing people I talked to were in Austin, but there was really no ecosystem around it. And so there was a ton of talent in the area. And
Yeah.
as tech converged with health, I saw a really promising role for Central Texas as a tech hub to leverage that into this growing healthcare ecosystem that's happening here, while
Hmm.
also leveraging the huge healthcare infrastructure that's statewide. And so that was the mission of Austin MedTech Connect, is to help Central Texas deliver the next generation of health tech and care delivery, really through structured connectivity between key stakeholders.
Thanks for explaining that. That really helps. And was there, and for people who are listening or who are learning about Austin Med Tech Connect for the first time, where can they, if they would like to, come for next events, where do you guys have them, or how can they go and look them up?
Yeah, check us out at austinmedtech.org or find us on LinkedIn at Austin MedTech Connect. And you can follow us on LinkedIn, and we also have an email newsletter that goes out monthly.
Perfect. Thank you. And I know you have a yearly conference as well, the AMC.
Yes.
Yeah.
So the summit, Semantic Connect Summit, when I started this group, there was always a vision of having one event that elevated the region, because we have a lot of potential and talent, but it's hard to know what the end looks like if you don't have that role model in your community. So Austin MedTech Connect elevates people who are building locally, people who are very successful locally, but also brings in the best of the best from around the country to engage with our people.
And that's amazing. And it sounds amazing that you're changing how people from different industries collaborate together. So thanks for doing that. And is there a particular project or success story that really stands out to you since you started?
Sure. I mean, one thing that comes to mind is I met Carl Robertson, and it was one of those things where the first time we met, I was like, okay, we should work together and do something together.
Yeah.
And we were able to work together, and he was a panelist on one of our Austin MedTech Connect events. And then there was another person, Nijar Munker, who we had worked together on putting a report around the Austin ecosystem.
Mm-hmm.
And it was just one of those things, just connecting people. And Nirjar, and then worked with Kyle, and now he's his kind of chief of operations. And so there's just a lot of stories like that where it's about putting the right people together uh, in in a way that, to me, I don't think of it as just random people bumping into each other. I think of it as what and who do you need to have in your, not even in your network, but to have a relationship with to get you to the next level, right? And so Kyle was looking to scale himself as he expanded his operations nationwide.
Mm-hmm.
And, it happened to be that Nirjar was in my circle, connected him with Kyle, and, they're working together and now helping his company grow. So that's the kind of thing that we're looking to do.
That's amazing. That would be. And what would be your vision? Like, where do you see Austin MedTech Connect in probably next 2 to 3 years?
So we really sat down and tried to mature the organization. We're in our third year now, and we broke it down into three goals. Our
Right.
first goal is to help health tech startups grow.
Mm-hmm.
Our second goal is to help healthcare organizations adopt technology. And our third goal is to work with local organizations like Opportunity Austin to attract large industry players to Austin. So those are our big picture goals. I mean, alongside that, it's kind of expanding our presence, our team, which we've done, and will continue to do in events and build connectivity statewide.
That's awesome. I know I've been to probably a couple of your events, and I've been to, I think it's the founders talk.
Focus on the founder.
Yeah, focus on the founders. Yes, yeah. So most of the events they have been really amazing, and I really appreciate it. And no, thanks for creating a space where everyone can come.
Appreciate you being a part of it, because we always tell everybody, like, thank you for being the best part of our community, because that's what really separates us, is all the amazing people who do come and engage, and that's what really sets it apart.
That's awesome. Let's move on to the next one. I know you mentioned about the other partners thing. I forgot it was. But let's talk about Caravan Health Ventures. What is it, and what should our audience or people know more about?
Sure. So, as I mentioned, I started an advisory group, and I was looking to, build it and grow it. And through that, I met with a lot of people, began working with a lot of companies.
Mhm.
And, I met Zane, who's now my co-general partner at Caravan Health Ventures.
Mhm.
He really had a long track record of working with healthcare systems and investing.
Mhm.
And so when we started working more together, we realized that there was a huge need from angel investors in Texas to be exposed to the best health tech companies in the US,
Okay.
but they weren't getting that. And then at the same time, with Texas being almost a $3 trillion economy, if you rank it globally, it would be eighth in the country with all the other countries. So
Mhm.
it's a huge economy, but at the same time, in the healthcare sector, it's very fragmented and difficult to access. And so we realized that with our network and our community, we could help these companies grow in the Texas market. And that obviously was interesting to not only the companies, but to the people investing in them. And so we partner with the best investment firms, Kleiner Perkins, Sequoia, many, many others. They send us companies they're investing in,
Yeah.
and then we diligence those companies with our own expertise as well as the expertise of our investors. We find the best ones who are not only the best companies, but a really great investment opportunity. And then we send these very, very selected investments. We'll invest in about 4 companies a year. So we
Mhm.
send these very highly curated investments
Mhm.
to our strategic investor group, right? And so then we fill this round, we syndicate it through an SPV. We can get more into that. Um, and we've been doing that for a little over 2 years now. So that's been a really good way to put it all together. Having that clinical expertise,
Yeah.
having kind of a strong community, and then kind of having this desire
Mhm.
to not just create impact, but also to enable clinicians to
Mhm.
have a voice in how technology is shaped. And a really good way to do that is actually through investing.
Interesting. That makes sense. And you mentioned about this. Is it only open to people who are they're healthcare providers, or maybe they belong in the tech industry, or is it open to the general public?
Yeah, so we do focus on strategic investors, so clinicians, healthcare leaders, previous health tech founders. but we do have room for basically people who are interested in investing broadly. And if you look at the venture capital sector,
Mhm.
health health technology is really one of the most appealing sectors because of the potential. It's a huge market that hasn't quite been penetrated by technology. And so most of the big venture firms have healthcare as one of the top one or two sectors of investment. And so it's a promising sector, but you want to do it with experts. And so we kind of provide that trusted resource to help people discern what's the right investment for them. And at the same time, we also educate our investors. A lot of them are new investors into how do you think about investing? How do you think about an investment portfolio? How much should you invest? A lot of these folks are our friends and family. And so we're not trying to necessarily sell anything. We're really trying to help people make an educated decision that is right for them.
Okay, perfect. Another thing, like a lot of people, I don't know the difference between what's an angel investor and what's they're like different type of investors. So
Totally.
yeah, would it be possible to just break them down so people can just at least grasp an idea of what different types
Definitely.
of stuff?
And we are also going to be doing a series called Angel 101, just kind of a primer on
Yeah.
investing, along with this is with the group called Docs in Tech, with Ikra Aftab and Mohammed Khalil lead this group. It's basically clinicians who are interested in technology, and so this is kind of our way to help clinicians, be more informed as they approach investing. But
Mm-hmm.
really, when you think about investments, a lot of people know about the stock market, right, which are public investments, and so anybody has access to it. You access it through the stock market or through your bank. With private investments, it's much more difficult to get access to the best ones. A lot of times you have to be an LP. And so when you think about a venture firm,
Mm-hmm.
there's the GP or the general partner, which are the people who run the investment firm. And then
Okay.
you have the LP or the limited partners, who are the people who invest in the firm. So if I'm a limited partner, I basically give like $1 million to
Mm-hmm.
Sequoia and I
Mm-hmm.
put it in their fund, and they take usually um, 2% a
Yeah.
year for 10 years. So take about 20% just to manage your money,
Yes.
right? And then they invest it across, let's say, 10 companies. And at the end of, let's say, 5 to 10 years,
Mm-hmm.
depending on how it does, you'll see some multiple of your money back if it does well.
Yeah.
For us, we basically take that model and we simplify it and we do it deal by deal.
Okay.
So let's say you're a promising startup company. Their current investment is called Metavis. They're transforming neurosurgery through augmented reality and AI guidance. And so, they're raising an investment round. And so investment rounds are structured, you've probably heard like seed round, Series A, Series B. So private companies raise investments at different stages to get them to the next stage. And
Stage.
at each stage, there's an opportunity to invest in them. And the best companies usually only let very select people invest. And that's not usually open to individual investors. It's
Mm-hmm.
usually only open to large venture capital firms or selected groups. And so we are one of those groups that invest alongside the venture capital firms.
Okay.
And what we offer to our investors or to our limited partners is to really learn about each investment versus just investing quote unquote blindly into the fund,
Fine.
to get to meet and know the
Yeah.
startup team, which is not easy to do. So that makes it a lot more enjoyable. Then also to grow together as a community and become more sophisticated over time. And so it's been a really enriching experience, and we really built an awesome group of investors along the way.
Oh, that's amazing. Thanks for explaining that. And yeah, I would love to be part of that Angel 101 investing because I don't know much about it. Yeah, but I would love to learn. I've heard of seeding round, but
Yeah,
actually don't have. I don't actually understand it.
yeah, I'd love to have you there. And there's a lot some books as well. Like I always recommend Secrets of Sand Hill Road as a good one to get started.
You said Secrets of Sand Hill Road.
Yeah, I used to do a series of LinkedIn posts. I might start doing it again,
Yeah.
which basically each post was one tip or one kind of insight on investing, kind of broken down like into bite-sized pieces. So I did it for many months.
Thanks for sharing that. Next, I would like to talk about the future of healthcare. I know you've been doing amazing stuff, not just in the clinical world, into combining the medicine and the technology part. Where do you see the technology and innovation in the next maybe 5 years in Central Texas, and how can that shape our future?
I mean, as everyone knows, healthcare is broken. I don't think it's controversial to say that.
Yeah, yeah.
Anyone who has had any healthcare issue realizes there are so many opportunities to make it better.
Mm-hmm.
Sometimes there's incumbents in place who don't necessarily want to make it better, but I think people are tired of really not experiencing the kind of transparency and efficiency and technology that they see in other areas of their life. Think of
Mm-hmm.
like banking as one. It's so easy to transfer your money, invest it,
Mm-hmm.
access it,
Mm-hmm.
versus healthcare, where there's really not much transparency, not much efficiency,
Okay.
not much technology. And so it's going to be, in my opinion, and in my hope, it's going to be changed in many, many ways.
Okay.
One is just basically adding efficiency to it. So ease of access to appointments, ease of access to your medical records, ease of access to medications and prescriptions. The other is transparency. So knowing when you go to see your doctor, how much are you going to be paying? Knowing when you pay your premium, what are you getting for that? And this extends to employers as well. Mark
Mm-hmm.
Cuban really had a great session at the summit talking about when employers purchase benefits for their employees,
Okay.
often they don't know what they're getting, and so they get ripped off by these pharmacy benefit managers, by these insurers who act as third-party administrators. And so
Mm-hmm.
I think employers, so these large companies, are starting to realize that they can get a lot more value for their money. And so I think that is part of the push. And there's a lot of technology aimed at employers now as well to help them provide benefits to their employees in a more efficient way. And obviously the huge one is artificial intelligence. What does that mean? You're already seeing it in terms of LLMs helping physicians do automated note taking. You're seeing it in tools like Open Evidence, where they have really kind of an easy way to get an evidence based answer on whatever clinical question you have. And you're seeing it in the revenue cycle space, where the whole financial process is a lot more efficient. You're
Mm-hmm.
seeing it in prior authorization. So there's like 100 different applications for AI in healthcare.
Yeah.
I think the big problem that we're seeing that AI is starting to address is the workforce crisis, where there's a shortage of so many different healthcare professionals,
Yeah.
from front desk, revenue cycle, to even medical assistants, nurses, even physicians. So
Mm-hmm.
that's going to be the interesting one, where how does technology help with the workforce? And it's a little bit stressful, because we want to use technology, we want to make it our job better, but we don't necessarily want it to take our job. And so I think that's where some of the stress is. But I think it's really important for clinicians to be involved as this technology evolves, because it can be used in 100 different ways. And
Mm-hmm.
if we're not at the table making the decision,
Mm-hmm.
our priorities aren't going to be represented. And I strongly believe that nobody in the healthcare organization has the patient's health and well-being in mind as much as the clinicians. And so I think when the clinicians' priorities are represented, for the most part, it also represents the best for the patients.
Better for patients. That's true. That's true. Thank you so much for doing what you do every day. And would you like to give a piece of advice to students or young clinicians?
Yeah, one thing I always say, which may be counterintuitive, is focus on your clinical training. When you are a student or early in your career, don't shortchange the clinical experience or the clinical training to do other things. There's going to be time for that. So never sacrifice the clinical training to
Mhm.
do X, Y, or Z. So that's my first piece of advice. Other piece of advice is, don't be afraid to get out there. Don't be afraid to get out there and just, raise your hand and say, yeah, the anti-imposter syndrome. Why shouldn't I be the one doing that?
That's true. And one thing before we wrap up and I move to the rapid fire round, Dr. Ali, I would like to talk about. I know you mentioned about AI and that it would take over job of clinicians or other. So do you think AI should be like regulated?
Yeah, I mean, of course it should be regulated. I don't,
Mm-hmm.
and it's already regulated, right? I mean, the FDA has software as a medical device around it. The
Mm-hmm.
harder question is, how do you regulate it? Because a lot of times there's not an easy way to track the outcome. I
Mm-hmm.
mean, there's multiple ways that you can put guardrails on it, like tools like the
Yeah.
Open Evidence don't necessarily, they have a set of structured data that they can use, and they can't necessarily just draw from anything.
Mm-hmm.
But we invested, for example, in a company called Qualified Health. Their
Uh-huh.
whole mission is to help healthcare systems put critical safety infrastructure around AI broadly. So we believed in that mission. That's why we invested in them. But things like ethical use of data, things like having equity in terms of your AI generated recommendations, because a lot of times, as everyone knows, human healthcare practice is flawed. And so you feed that into an AI model, it's going to result in flawed recommendations. And so how do you prevent that? How do you even recognize that? So that's the challenge.
Thanks for sharing this, and that I appreciate your thoughts on it. Now let's switch gears with some rapid fire questions. Just answer with the first thing that comes to your mind.
Sure.
Or coffee in the morning.
What was it?
Tea or coffee?
Coffee. Yeah.
What's one morning ritual that you never give up?
So I'll be honest, I'm not a morning person, but one thing that I do almost every day is I do have a smoothie almost every morning, like a protein shake. And that kind of gets me through the first half of the day.
Okay, that's awesome. And I know you also serve on the board of the Refugee Collective. So, what's one lesson that's taught to you about healthcare and humanity?
Sometimes you think that you want to, build a hospital or have this huge healthcare initiative, but even impacting the life of one person is really meaningful. And so that's something that this organization really taught me is that, like even if they employ, like, let's say 20 people and now we can employ 21, like to that one person, that's a life-changing experience for them, and to not let that hold us back from doing something good.
That's true. I totally agree. Before medicine, what did you want to do when you grew up?
I don't know, to be honest,
Okay.
is the honest answer. I mean, I consider engineering, but I think just because that was kind of the expectation. But I always thought, honestly, like this is maybe just childish, but I always thought being like a fighter pilot or something like that would be really cool. So we'll see. Maybe my third career.
Oh my God. Okay. Yes. One piece of medical tech you wish existed that doesn't right now.
I would say when you go to the doctor
Mm-hmm.
and they tell you what you need to do,
Mm-hmm.
the your costs are really clearly broken down beforehand. So like when you go to the mechanic, it's like on the board, right? Like oil change $30, tire rotation like $50. So like I want to have that same consumer experience for healthcare, and I want cost transparency across the financial cycle, like cost transparency for the patient, for the
Yeah.
healthcare organization, for the employer. So just to have this
That's true.
total ambiguity around the
Mhm.
financial process, which prevents, market economics from actually happening. So I really want that. And part of it is not having this weird coding and billing nonsense.
Yes, that's true. I agree. I totally agree. If you could give one piece of advice to your younger self, what would it be?
I would say don't be so hard on yourself.
Okay, that's a good one. Okay. If you could have one surgical superpower, what would it be?
Surgical superpower,
Yeah.
man. I would say to speed up healing.
Okay. Okay. That's a good one. Best way to spend a rare day off.
Rare day off.
Yeah.
Yeah, you mentioned the Miata. I used to like taking the Miata for a drive. I used to work at a rural clinic, and so it wasn't even a day off, but there was kind of some nice roads going out there towards Smithville. So that was kind of fun to take the Miata out there.
Yeah.
But now, honestly, it's mostly just getting outside with the kids. Yeah,
For the last one, your Miata, board meetings, or the operating room, which one gives you the most adrenaline?
adrenaline.
Yeah.
So that's a good question. I would say the most positive is probably the Miata.
Okay.
The most stressful, ironically, is the boardroom.
Mm-hmm.
And kind of the most kind of what you talk about is adrenaline is probably the operating room as far as like
Okay.
like a good stress.
Good stress. Yeah.
Yeah,
That's amazing. Thank you so much for playing along, Dr. Ali. It's been such a pleasure talking to you today. And for all our listeners, where can they learn more about not just Austin Connect, but also, maybe about the health venture part you mentioned?
sure. Yeah, so Austin MedTech Connect is austinmedtech.org.
Mm-hmm.
The Caravan Health Ventures is at caravanhealth.vc. And then you can always find me on LinkedIn. It's Jawad Ali MD. There's a knife next to it for surgery, so it's easy to find.
That's perfect. And thank you so much. I really appreciate all your insights and all your time. It's been amazing discussion. And to all our listeners, thank you for tuning in today. And remember, your health journey is unique, and it is okay to seek care that truly works for you. If you enjoyed today's episode, don't forget to subscribe, share, or leave us a review. Until next time, take care and stay balanced. Thank you so much.